I'm Scott Kellerman. Thanks, Greg, it's an honor to be here in your studio. I'm here to talk about Rotary. I've been a Rotarian since 2001. Parenthetically, that's the year that my wife and I shifted over to Uganda to work with the Batwa Pygmies. For the first 2 years, not much was happening on the ground, but as soon as we put up a little clinic, along came Rotary and the Rotary Foundation. And Rotary's been involved with us ever since. This photo that you see, not everybody in the picture is a Batwa Pygmy. The fellow in the back is a guy named Steve. And he came over with a 2-week Rotary trip and stayed 5 years. So watch out for those short-term Rotary trips. We also, if you come, you have access to seeing a lot of the animals. We live close to a game park where there's warthogs, elephants, and lions. The Batwa, even though they're impoverished, every morning I wake up to singing and drumming. So if you come over, bring your dancing shoes. There's a quote by the Batwa saying, "Where there's hope, there's no darkness." It's interesting because the Batwa have no future tense in their language. Is hope only a future tense for you? Or is it something in the moment, a present tense? Can you put your full weight down on hope? They can, and I think Rotary does too. Rotary does bring hope and health. Batwa are very diminutive. That's Past District Governor Dave Denny. He's a tall guy, but the Batwa are very diminutive, average about 4.5 feet in height. They produce little bitty babies. When we first went over, we did a survey in the year 2001, and what we found was pretty overwhelming. Their life expectancy was estimated to be only to the age of 28, annual income of around $25 a year. 38% of the kids were dying before the age of 5. When we first moved there was no healthcare delivered in the area. My wife's a teacher, there were no schools, so we spent the first few years living in a tent, traveling around, learning their language, their culture, and tradition. It was a bit of a challenge moving from California into a tent, but it was great for our marriage. We woke up in the morning and discussed the issues of the day. It's a very simple life, and I think it's a sure path to marital bliss living in a tent for a couple of years. Our medical interventions consisted of mobile medical clinics. We'd drive to the end of the road, and we'd start hiking with our medical supplies, and drums would announce our arrival. We'd just come to a big old stately fig tree, big ficus tree, where we'd start setting up our ICU. Our ICU is underneath the shade of the tree. We'd hang IVs from the branches of trees, dripping life-saving quinine into the veins of kids suffering from cerebral malaria, which is universally fatal if untreated. We'd see anywhere between 200, 300, and sometimes 500 people a day at these clinics, and we did that for the first couple of years. Where do you go without a healthcare system? I'm a doc, I'm not an administrator, I don't know how to put up a hospital. My wife's a teacher, she didn't know anything about schools. But where do you go? What's the direction? So in the year 2004, after we'd been there about 3.5 years, we put up an outpatient center and then put up a maternity unit. And the reason for the maternity unit was the maternal death rate was 880 maternal deaths per 100,000 live births. If you do the math, for every 113 live births, a woman would have a tendency to die in pregnancy. That was some of the highest maternal mortality I could find on the face of the planet. So our focus then, and continues to now, is maternal and child health. Once we got up to clinic, along came Rotarians. Rotarians just engaged. They wrote, say, how can we help? And I said, come on over, and they did. The first group was actually from Nevada City, Grass Valley area, and the first thing they brought over is an x-ray container. They outfitted the x-ray here in the U.S., put it in a generator. All we had to do was pull out the generator and plug in the x-ray, fire it up, and off we went taking x-rays. We had the only x-ray unit in southwestern Uganda. Now we have a 155-bed, full capacity, full service hospital, which is ranked one of the best hospitals in all of East Africa. We now have another x-ray unit donated again by the Rotary Foundation, a recent grant. Now this is the digital unit, high quality digital unit, and hopefully we'll have a CT scanner within the next year or two. Our pediatric wards are open and airy and fit right within the culture. All of these incubators, we have the only neonatal ICU in our area. We have 20-bed ICU. We do a lot of cesarean sections because we're a referral hospital. All of the ICU equipment in our pediatric neonatal unit was donated to the Rotary Foundation from a grant from Grass Valley Rotary Club. Now we offer definitive surgeries. We do fistula repair, cataract work, orthopedic work, GYN surgery, all kind of surgery there. All of the equipment in our operating room came through the Rotary Foundation, primarily through grants that originated in District 5190. We now have the only ICU in the region. There were 48 ICU beds until last year. Now there's 52. We added 4 ICU beds. All the equipment came from a Rotary Foundation, from a grant from a group in Westport, Connecticut, Rotary Foundation, who came over and helped us with the installation of the equipment. And also we had a fundraiser there, which is an all-night Rotary dance. We danced all night to raise money for Rotary and the Westport Rotary Club. The kind of short hitters, they were only able to dance till 3 or 4 in the morning, but come on over and dance with us. This is our ICU staff. And we have consultants that come from all over. This is a school we found. This is not a good place to study. The school is falling down. I mean, there's in no way that kids could get a good education there. We now have over 1,500 kids in schools. We've put up 3 schools. They're high quality education systems. All of the equipment for these schools came through Rotary Foundation. There's a dearth of healthcare providers, and one of the things we thought we would do is train nurses, because what a nurse will do, a registered nurse, is they can run out anywhere between a 10 to 25 bed hospital, do all the admissions, discharges, oversee the deliveries and the minor surgeries that we do there. So now we have a nursing school, has about 450 students. In the back is our simulation lab, an 18,000 foot simulation lab. All of the equipment for the school was provided by donations from District 5190, a Rotary Foundation grant. There's Alexa Curtis, local nurse practitioner. She came over and taught her in our nursing school. We have a collaborative relationship with UNR, University of Scranton, University of San Francisco, for distance learning. All the equipment in this nursing school, you can see right here, this is our simulation lab. All the computers are provided by Rotary grant, and all the mannequins, which we do teaching with, are provided by Rotary. And parenthetically, the computer lab is based on the nursing school at University of Nevada, Reno. This is Jerry Hall, helped with this grant. Water and sanitation are a real problem. Major killer of kids under age 5. This was recognized as Rotary. One of the first grants we had was a Health, Hunger, and Humanity grant. The grant was a 3-year grant, lasted 7.5 years. We were one of the last of the 3H grants to close. The reason it took so long is the first 2.5 years we had hydrologists from this county come over and talk about water and sanitation because the people were not aware of germ theory of disease. So we got them sensitized, and they built all the systems. The results are quite impressive. Diarrhea rates plummeted over 50%. I lecture at a number of public health schools, and I'll show this slide about the diminution in the amount of diarrhea rates, and they said, that's impossible. It's a miracle. Yep, it is a miracle, but that's what Rotary does. It provides miracles. This quote from Maya Angelou, life is not about the number of breaths we take, but the moments that take our breath away. I'm sure you've had breathtaking moments in Rotary. That's what Rotary's all about, fellowship and those breathtaking moments. This is our maternal health unit. These are the roads We have no paved roads around our hospital, and we live in a rainforest, so the roads get impossible. One of the reasons for the high maternal mortality rate is that if a woman is pregnant and has a complication and tries to walk to our hospital, it's a 1 to 2 day walk, and neither she nor the child will do well. So we put up was a pregnant mother's hostel where a woman can come and stay as long as she wants to stay. We have a kitchen and laundry and a place where education is available and access to cesarean section. This is part of the education we do. And then we have access, this is actually our new cesarean sections there in Uganda. The results are nothing more than extraordinary. We've dropped the maternal mortality rate by over 90%. I was a Fulbright scholar and had a chance to study maternal mortality, and as I mentioned, it was 1 in 113. I looked at, before we started these programs of intervention, I looked at the last 7,000 deliveries after we started these interventions, and there was 6 maternal deaths, and 2 of the women had AIDS and refused to take the antiretrovirals. Again, another miracle provided by the Rotary Foundation. Malaria is a major killer in sub-Saharan Africa. Over 600,000 kids under age 5 die every year from malaria. We went out to distribute bed nets, and they were poorly received because people believed that malaria was caused by Stan, a demon. You say, why? Golly, that's strange. The reason is because kids under age 5 get cerebral malaria and they seize, and for them, the local population, they believe that's demon possession. So we work with our friends, the Abafumu, traditional healers. Some people call them witch doctors. We brought them in and took them down to the hospital, showed what the parasite looked like under the microscope, took them to our ward, showed them about blood transfusion, treat malaria, and then we had some Rotarians over that showed them the life cycle of the Anopheles mosquito, how it bites at night. And they went out and helped distribute bed nets. The results are nothing more than, again, miraculous. 40% of our outpatients used to be due to malaria, now 2.5%. We were losing 1 to 2 kids every week from malaria. Now we go 6 to 9 months without a child dying from malaria. And this is all, the bed nets obviously came from Rotary. This is our dental unit. We have 1 dental chair serving a population of 250,000. Most people, 2.4 billion people in the world have no access to dental care. This is Jerry Hall and Harry Ald, a little different type of dental procedure. Blindness is a real problem in sub-Saharan Africa. Quite a few of the people, 1% of the population is blind, but they're not traditionally blind by what we think about in America. Cataracts are a problem there, but trachoma is caused by chlamydia infection, a bacterial infection. It can be prevented and treated by antibiotics. 2.2 million people are blind in sub-Saharan Africa from trachoma, and 50% of the kids are infected with chlamydia. So this is a preventable and treatable illness. River blindness. Over 1 million people are blind from river blindness. This is prevented by a treatment called ivermectin. Vitamin A deficiency. 250,000 people in sub-Saharan Africa blind. So the process right now is we're hoping to put up a dental and vision clinic. Half the kids in sub-Saharan Africa that are blind will be dead in a year. We broke ground for a dental vision clinic when I was back a few months ago, and this is what the clinic looks like. One of the projects I'm involved with, because we have a hospital working next to a forest, is to prevent the next pandemic. So we're working with UC Davis and the National Institute of Health, where we're studying the bats, the primates, mosquitoes, and the humans, looking for spillover of the virus into the humans, looking for new viruses, and hopefully able to prevent a future pandemic. This is a picture of how close you can get to the mountain gorillas. This is a real issue. A mite could jump on this guy and spread a disease, and a few days later he's home. Honey, that's what I brought home. So this is a study we're doing, hopefully to prevent a pandemic. Volunteers are always welcome. The issues in the world we know, mortality under age 5, where is it? 50% of the world doesn't have access to health care. How do we deal with that? I think we can do it collaboratively, working through Rotary. The Batwa have expression, agari, hame, nigu, agate, gufa. It takes all the teeth to break a bone, where united we stand. And that's what Service Above Self is. It's all about working collaboratively to deliver health care all around the world and do it in the spirit of liberty. Makama Simwa. God bless.